We're here today to talk about the current U.S. opioid epidemic. Unfortunately, we've had a huge increase in the number of opioid-related overdoses and death. Today, we're going to talk about how you can help save a life if someone's experiencing an opioid-related overdose. Naloxone is a medication that's used in emergency situations in which someone has a known or suspected opioid-related overdose. Naloxone is an agent that actually reverses the effects of opioids in order to help save the life of someone who may be experiencing a bad reaction to an opioid medication. Common opioids that you may be familiar with are fentanyl, heroin, hydrocodone, or oxycodone. Naloxone is safe to administer to anyone and can be administered by anyone. Naloxone works by actually reversing the effect of an opioid once a patient has already taken the opioid. So it can help to, if a patient's unresponsive, bring them back. Naloxone does only work for a short period of time, so it's still important to call 911 after you've administered it, in case the patient goes back into a recurrent overdose once the naloxone wears off. Naloxone is actually accessible at any USC pharmacy without a doctor's prescription. All you need to do is walk into the pharmacy and ask to speak to the pharmacist, and they'll be able to provide a naloxone to you. If you use opioids, you should definitely have naloxone on hand at all times and teach those around you how to use it as well. Even if you don't personally use opioids, it might be a good idea to have naloxone in case you're around someone who uses opioids and may react badly to them. Naloxone is actually safe to use in anyone, whether or not they're actually taking opioids. If you accidentally administer it to someone who you mistakenly think is experiencing an overdose from opioids, it's actually not harmful and it won't cause any side effects for them. But it can help you save a life, so it is important to have it on hand at all times. When you're ready to administer naloxone, have the person lying flat on their back and tilt their head back. Unwrap the naloxone from the packaging. Place your thumb on the plunger and your index and middle finger on either side of the nozzle. Put the nozzle in the patient's nostril up until your fingertips are hitting their nose. Press firmly on the plunger with your thumb all the way in. The dose of naloxone has now been administered. Turn the patient on their side and place their arms underneath their head and tilt their knee forward. Once a dose of naloxone is administered, call 911 immediately. It's important to call 911 even if the patient wakes up because naloxone only temporarily reverses the effects of opioids. Someone who wakes up after a dose of naloxone can have a recurrent opioid overdose once the naloxone wears off. If a patient shows little or no response to the first dose of naloxone, administer a second dose in the other nostril after 2 to 3 minutes. Continue to monitor the patient until help arrives. Some common side effects that someone might have after receiving a dose of naloxone are shaking, restlessness, irritability, sweating, stomach cramping, diarrhea, or body aches. Again, naloxone is not harmful to anyone and these side effects are only temporary.